Drum roll. Good morning, everybody. Thank you very much for attending this morning. And we have a great group of folks that are very helpful and essential to our healthcare services and the palliative care services here at Lowell General Hospital. Like I said a few minutes ago, it's so important for us to know where this fits into the healthcare system and the support that these folks can provide to families and to our staff. This morning we have Virginia Doherty. She graduated from Case Western University and then UMass Worcester School of Nursing, my old alma mater for the medical school, and is a nurse practitioner in palliative care, as well as a clinical instructor at Tufts University School of Medicine. And Kristen Scanlon, also a nurse practitioner, product of UMass Lowell's Masters of Nursing program and St. Joe's College of Maine School of Nursing, and is a nurse practitioner at our palliative care program, as well as Deanna Domenico, who graduated from Walden University with the Masters of Science in Nursing, prior to that from the St. Anselm College School of Nursing. And they're going to talk to us today about the ConnectCare Hub and both inpatient and outpatient palliative care services, what they have to offer to us and our patients. So without further ado, I'll let you get started. Also, just to remind people, in the chat box, there will be a link to the program evaluation. So please fill that out. And if you have any questions in the course of the talk, please post them in the chat box and we will answer them at the end of the program.
Good morning. Thank you, Dr. Sidebottom, for that introduction. My name is Kristen Scanlon, and I'm going to start by talking a little bit about kind of reviewing what palliative care is, talking a little bit about the differences between palliative care and hospice, studies that have shown benefits of palliative care to help understand why introducing patients to our service, hopefully earlier than later, can be beneficial, and to talk about the services we have available to patients, both inpatient and outpatient. Next slide, please. Our team. Dr. Guntori is our medical director and is a medical oncologist. She does not see palliative care patients, but is a resource to us and an advocate for our program. Virginia Doherty, as Dr. Sidebottom mentioned, she is mostly our outpatient nurse practitioner at this point, although does help out on the inpatient side if she has a no-show or a cancellation. On Mondays, she sees patients at the ConnectCare Hub, which is at the Saints campus, and Tuesday through Thursday, she sees patients at the main campus and has been very flexible, seeing patients pretty much wherever they show up. So it's been a little difficult helping patients know where to go, but she's been very flexible in getting her steps in, walking all over the hospital. And Deanna and I are primarily the inpatient nurse practitioners doing consults at both the main campus and the Saints campus. We see patients on all the inpatient units in the ICUs, and we do sometimes go to the ER as well. The inpatient service is Monday through Friday. Next slide. So palliative care has, a variety of definitions put forward from several organizations, but in general, palliative care is a medical specialty that supports patients and their families with a life-limiting illness or a serious medical challenge, which sometimes shows up in, the ICU on the inpatient side, someone who maybe doesn't have a chronic underlying medical problem, but is faced with a very serious illness. One great example is, of course, the pandemic and being asked to see patients who maybe didn't have any other medical problems, didn't have life-limiting illnesses, but were now dying of COVID. That was, certainly a way that we grew. But in general, most of the patients who we see are patients who, are expected to have limitations over the course of their illness. So, definitely advanced cancer diagnosis, dementia, heart disease, lung disease, pretty much any organ disease that is chronic and progressive. And the goals of palliative care is to improve quality of life, helping patients and families to kind of better understand their illnesses, to be prepared to make some of the decisions that may come up as their health changes, to assist with managing symptoms that are related to their disease. So pain related to cancer or other chronic illnesses, shortness of breath as it relates to advanced heart failure, advanced lung disease, and kind of supporting patients as they deal with those symptoms. Ideal palliative care teams involve lots of specialties. So, providers, but also nurses, social workers, chaplains. Well, as you've seen from our last slide, our team is made up of providers, but we work very closely with the other specialists and ancillary staff, both on the outpatient side and the inpatient side, to collaborate, constantly providing education and working together to kind of promote the best care for patients and improve their quality of life as best they can. Next slide, please. I feel like this slide could take up a long time, so I'll do my best to summarize it. I think there's a constant need to review the differences and similarities between palliative care and hospice. It is not uncommon for us to hear from families, staff, providers, or to come across a note where it says, we'll consult palliative care / hospice. We can usually delineate what that means, but I think that it's important to kind of remind everyone, kind of what the differences are between palliative care and hospice. Palliative care is support at any stage in a serious illness. And therefore, as you can imagine, it includes a large amount of patients because it could be someone, in the early stages and early diagnosis of a cancer who may go on to get second, third, fourth line treatment. But we prefer, of course, to be able to see those patients early in a diagnosis to support them and to work on a relationship throughout the life of their illness. Whereas hospice is specifically for patients who have a expectancy of 6 months or less. As I'm sure it does not come as a surprise, many patients sign on to